Hi, welcome. My name's Harvey. I'm with Respiratory. I'm going to go ahead and do our competency checkoff list for the incentive spirometry. So just like anything that we do, we have to verify the physician's order. We also have to scan the patient's chart. We're going to go ahead and get our equipment ready and obtain what we're going to be using today and assemble it. So this is our incentive spirometry. As you'll notice, there's two little arrows here. There's also a little arrow, well, some type of like blue little device here that floats between the arrows. And then you have a number from 0 all the way up to 4,000. And then you have a right handle. And then you're going to have a corrugated tubing that we're going to expand. This is going to go onto the front of this. Okay. Then you can put this like this so it doesn't get dirty, because you want to keep everything clean. I have a chart here that I filled out already. So this chart will tell you, based on male, female, height, and age, where you should be. So my numbers kind of fall in the middle. I'm 71 inches tall, I'm a male, and I'm 47 years old, so I went with 45 and 3,500. So I'm going to go ahead and set this here. It's also giving you a way to track, so you can track your numbers. So I'm going to go ahead and get everything ready. So I'm going to identify the patient. My patient's name is Mr. Dexter. I'm going to knock on the door. I'm going to observe my universal PPE. Hand washing, wash my hands, put my gloves on. Hi, Mr. Dexter, my name's Harvey. I'm with Respiratory. I'm going to go ahead and do incentive spirometry with you. Have you ever done incentive spirometry before? Okay, you want to always ask your patient, because they may have done it, they may have not. Even if they have done it, I recommend to explain it again. So, Mr. Dexter, what we're going to do is we're going to go ahead and get everything ready. So I've assembled this for you. And you're going to want to hold this in front of you, straight up and down. Your numbers are going to be 2,500, okay? And I'm just putting something out there just to simulate the technique. Now, any patient that's going to do this may be sore. They may have had a procedure done. They may not be able to do their number. The most important thing that I like to focus on is your technique. So as long as you're doing a good technique, you're doing good. So we're going to do this 10 times an hour. I don't recommend doing 10 straight, because you might make yourself tired or lightheaded. What we recommend is sometimes during commercials, do a little bit, then take a little break, and then do a little bit more for the next commercial. So I'm just going to go ahead and, if I was doing it with Mr. Dexter and he could do it, I would set him up, have him hold this, and then make sure that we adjust everything accordingly based on his age, his height, and his if he's male or female. So I'm going to go ahead and do this just for simulation. So your mouth has to be on the mouthpiece. You have to have a good seal, no leaks from the side. You want it straight up and down. You don't want it curved or tilted. So I'm going to go ahead and demonstrate. You can either take your mouth off of it and blow out, or you can let it, you kind of hold your breath and it will fall back down. So I'm going to show you again. I like to take my mouth off. And kind of breathe out when I do it. But there's a few ways to do it. It's whatever you're comfortable with. So if you're noticing, I'm almost getting to the 2,500. I'm going to do it one more time. That time I did go over, so that was 3 times. Now, an example of not doing it correctly, I want to go ahead and show you. So the first couple times I did it really fast, it shot above the arrow. The next time I did it kind of fast, it stayed above the arrow. As long as your technique is slow, deep breathing, and you're doing it correctly, that is my main concern that I'm happy with. I do want you to do it properly. If you're not doing it properly, it won't be effective for you. So if you were going to do this with the patient and they were doing it incorrectly, you would just help them and make sure they're doing it correctly. You would emphasize the importance of this device. And then I also want to mention that there's current literature in the AARC website that says that this is not as effective by itself. You need to be having the patient active, mobile, We always want to stay ahead of our current and greatest and latest data that's out there for the devices that we use. So I do recommend you go on the website and read what they do say about this device so that you will be informed and be able to teach it better to your patient. After you're done, you're going to go ahead and put this back here. Make sure it's within reach of the patient, because the patient's going to be kind of doing it themselves throughout the day, and you want to make sure that they stay motivated to do it and encourage them to do it. You want to make sure that if they have any questions or anything, that you do answer them. I always like to bring a second one in the room just in case this falls. It is plastic, it will break, and it will go in the trash because they're not that expensive, but they work good. Mr. Dexter, do you need anything else before I leave? Make sure the patient has his call light within reach so that he can call his nurse. Make sure you do anything he needs. If he needs another pillow, if he needs a blanket, if he needs something adjusted, adjust it for the patient. Thank you very much. So then you're going to leave the room. You're going to document, clean up anything you would have left, any type of mess, get rid of anything you may have left behind. Also give them a little bag to put their device in for when they take it home. That's all I have. Thank you and have a great day.